Hello, and thank you for joining us for the training today. Today we're going to be talking about clinical aspects of the conditions of participation that were released in January of 2018. And we're going to show you how you can comply with those conditions of participation using Barnestorm Point of Care. To get started, I'm going to go ahead and show you the search function. This will allow you to look up contact information for employees in the system. So if you want to find one of your coworkers' contact information, you can look up your coworker by name and click on their name, and that's going to give you their cell phone or whatever phone number is in the system for them. On this particular record, there's not a cell phone recorded, but we have put in a recommendation for the clerical staff to add phone numbers for each employee, so that you should be able to find that in the system within the next couple of weeks. You may already have it in the system though. You can also look up doctor contact information as well, and it's the same thing where you can start typing the doctor's last name and click on the doctor, and that will give you the contact information for the doctor as well. And down at the bottom you can see any patients that are being seen by that doctor. And I'm going to show you the emergency plan. You'll notice the emergency plan is a new button here on the main menu for Barnestorm. This corresponds with the emergency plan that is also available in the referral record for the patient. So if you ever need to update the emergency plan for a patient, you can come in here and set the risk level, acuity level, and then the priority level, which establishes when the patient would need to be contacted in the event of an emergency. The patient's evacuation plan, and that is a very important part of conditions of participation, as well as any special needs that would influence the emergency plan. You can type in other needs if needed for that particular patient. And this will give you the ability to print off your emergency plan as well. So this is important contact information. The emergency plan is required to be established and reviewed for all patients. So this is something that should be conducted for each patient. The next couple of items we're going to talk about are back on the main dashboard, the first screen when you log into Barnestorm. One of those items is one that should be filled in for you to comply with conditions of participation, and it's called the My Patients button. It is in the upper right section where you find several buttons up here. It is the fourth one down. So if you click on the My Patients button, what you're going to find is a list of your patients that are active in the system. If you do have a patient that is under your care that is not on your list of patients, you can simply let your office clerical staff know about that, and they will be able to add you to the patient record. You still have all your patients in the system. All the patients are in there, and you can still search for them by name. So you still have access to all of the patients in there. The My Patients button is just a quick way to very quickly get a list of your patients. It's a little bit faster than searching for them by name. So I recommend using that button as one of the first things that you would click when you come into the system. The other button we're going to talk about up here is My Schedules. We recommend using the schedules part of Barnestorm for your clinical visits. You can schedule out all the visits for an episode when you do a start of care or recert. And what that does is allow you to track which visits were scheduled against which visits were actually made in the system. So it gives you a lot of flexibility in terms of watching your frequency. So I'm going to go ahead and click on the My Schedules button so I can show you what it looks like. And what you'll see here is my schedule. It has the day and the date and time of each scheduled visit. And the time allows for a lot of flexibility. So you're not locked into a specific time. You have a large range of time that normally is a whole day that you can make that visit. So I don't have to get there at 12:08. I can get there at any point in the day, and it will still mark that visit as completed in the system. So you're still going to be able to go out to the patient home at any time and make the visit. But from the My Schedules, when you click on that scheduled visit, what you're going to get is a quick preview of the patient. It's going to give you the patient's phone number, their age, and what kind of visit is scheduled. All that information is in here. The comments area on the schedule screen also may have additional information. Your office staff can make notes on what needs to be done in the visit, and they may put those under the comments. Once you're ready to actually start an assessment from the schedule, all you need to do is click on the Start Assessment button. What that does is launch the visit itself, and this is the visit note that you're familiar with, but the only difference is, since I used the schedule to launch it, all of my answers up here for the assessment type, payer, job code, and visit status code have already been filled in for me, so I don't have to do that part. At this point, all I would have to do is click the Start button to go ahead and start my visit. So using the schedule does allow you to avoid having to do this kind of thought process at the beginning of a visit, where you're thinking about what kind of visit are you doing, who's the payer who's going to be charged, what's the job code, and what's the visit status code. All of those things are taken care of for you when you do your schedule ahead of time. So that's one of the main reasons to use the schedule as well. From here, I would like to mention that Barnestorm strongly recommends that each visit is documented at the time and location of the visit in order to meet Medicare conditions of participation. We have timed the time it takes to document a visit, and for a regular scheduled visit, it's an average of 7 minutes. And we recommend documenting it according to the Medicare specification, which is at the patient's home. So to do that, basically what that means is you would pull this up at the patient's home, and then when you're ready to go ahead and start your visit, you will click the Start button as you normally would. That's going to go ahead and timestamp your visit. Okay. From there, you can open up the required items and the optional items if you like, and you'll be able to see all the items that you can document for that visit. Okay. I'm going to talk about some of these screens individually related to conditions of participation, but there are a few other things that I wanted to go over first. I have a button called Info. If you click on that button, you actually are going to get all of the patient information as you would normally get if you went to Patient Info in Office or Point of Care off of the main menu. As well as that, you have a lot of other information that's supplied up here, including the patient's diagnosis history, medications, surgeries, facility stay. The next thing I'm going to show you is screens that are required for you to complete on a visit note to comply with conditions of participation. Many of these screens have not changed at all and will be very familiar to you, but there are a few new ones, and we're going to go over both. One of the ones you're very familiar with is Review Meds. Medication review is a big part of conditions of participation. And what you'll find is if you go to your review med list, you're going to want to mark all meds as dose, frequency, and route verified. And just make sure that the medications are what the patient's actually taking and that the dose, frequency, and route is accurate. Another screen we're going to talk about that hasn't changed much is the aid supervision. We have added a few items up here at the top to make sure that you comply with what needs to be documented for aid supervision according to conditions of participation. So you will find a few new checkboxes up here at the top that Barnestorm has added on for you. So you will simply document these, and you can look at the conditions of participation to find out the frequency on doing aid supervision. But it is every 14 days. We recommend just going ahead and doing aid supervision and checking these items on each clinical visit just to make sure that you meet the compliance. The next item I'm going to show you is one that has been in the system for quite some time, and that is infections. When you click on the infection screen, you will see that there may not be any infections listed, but if you need to document an infection, you would do that by clicking on New Infection. Select the infection types and say when it was acquired. You can just leave the date if it wasn't acquired at start of care or within 48 hours of start of care. If there is a location you want to specify for a skin infection, you can do that. You can indicate the infecting organism and the cause. You can indicate symptoms as well, or in here, and if you've got any comments, you can type those. You also have the option of indicating any treatments that are being done. You can pull down and do an antibiotic. You can do culture, and you can set the dates on those. And as well, you can do a plan of action where you will just check off the plan of action. You can indicate a monitoring plan and a summary of outcome as well. Once you have your documentation the way you want it, you can go ahead and click on the Save button. And this infection is going to appear for this patient every time they get visited by clinical staff and point of care. And what this is going to show you is the type of infection, when it was acquired, and what the status of that infection is. You can complete an infection and mark it as healed once it's done, so that it will just appear in here as a history. Make sure that you document all infections here, as this is an important part of tracking your quality of care. Another item that you should be familiar with are the fall assessments. If you go to the fall assess screen, you're going to find that you have a fall assessment. This is the MAHC 10 fall assessment, which is the standard one. What you can do is go ahead and click the answers in here. And once you get to the bottom, you can see what your score is right down here. It says a score of 4 or more is considered at risk for falling. So if the total is more than 4, then the patient is at risk. You can print this form out separately from your visit if you need to. You can just print interventions or so on. So you have a couple printing options. You can also make comments here. And then you also have several other options for how to assess your falls risks, okay? One of the items I want to talk about on this screen is the color coding in Barnestorm. What you're going to notice is here under required and optional, you'll notice red items. Each red item must be documented on in Barnestorm in order to complete the requirement for documentation. When you have done documentation in the item, it will turn green with a green check mark. All the items that are optional in the system are appearing as blue. You will see this blue icon here. And the same color system appears up at the top here on your tabs for screens that have multiple tabs. So what you'll notice in here is your tug, your timed up and go, appears as blue for optional. It's your option whether you would like to document the tug or not on this particular visit. However, you'll notice that there is a red item here, and this is your OASIS item, and I happen to be in a start of care visit right now, so this item is required. And so it's going to appear as red until I go ahead and answer that question. When I do that, the OASIS item turns green and the tab turns green as well, indicating that I have completed a required item. One of the other screens that you're going to want to make sure you check, of course, on your visits is ADLs. For any OASIS generating visit, ADLs are really important to tracking your patient's condition. Now I'm going to go to the pain screen. You should also be familiar with this one. It hasn't changed at all. But just to point out again, for an OASIS visit on the pain screen, these items are going to appear as red for required. If your visit is a regular scheduled visit, these items will appear as blue as optional. The conditions of participation have indicated that it is okay to document on OASIS items for visits that don't even require an OASIS. So that's why you will see OASIS items within your visit, even on a visit that doesn't require them. According to conditions of participation, we have to make that available to you so that you may document on it optionally as a way to track your patient's condition a little bit more accurately in between the visits that require OASIS. Another screen I want to talk about is the homebound screen. This one is one you should have been using as well. This came out months ago, so you should be documenting the patient's homebound status. So this is the primary screen to document your homebound criteria. The next screen I want to show you is one that has been in the system for a long time as well. You may be familiar with it. It is called psychosocial. This item is required on each OASIS generating visit for conditions of participation. Another screen that you want to document on is called cognitive. This screen we have pulled in some items that you are already familiar with, and these are the MOO items, the OASIS items. That you should already be familiar with these from doing them on your other visits. So those are the same as they have always been. You'll also see a mental tab in here where you can document mental status and cognition. But then you're going to find some new tabs in here as well that we've pulled together from different parts of the system. You have your BIMS, your brief interview for mental status, delirium, the PHQ-9 depression assessment, behavioral symptoms, and then of course the history and teaching tabs, which are available on many of our screens as well. The next screen has been in the system for a long time, but it may be one that you haven't used, and you will need to use it to comply with conditions of participation. So let's go ahead and I'll show you how to use it. It's called Patient Facility History, PT Facility HX. So go ahead and click on there. You do have a few OASIS answers on this screen, but the second tab, which has a blue optional setting, is called Facility History. What you need to do for conditions of participation is record each hospital stay that a patient has. Most hospital stays will be associated with a transfer OASIS as well, but you will also need to record the hospital facility history here. To do that, you can just start typing the name of the hospital. If you know the dates of the patient's stay, you can put those in, or you can just put in the from date, and the through date you can come back in later and put that in. So, and then if you know the patient was admitted to the hospital, you can put that in here as well. So this is very important because it does allow trackability of hospitalizations in a way that goes beyond a simple OASIS transfer. So go ahead and click on Save once you've got that recorded, and there you'll be able to see the patient's facility history. Next screen I want to show you is important for your 485, and it's a screen that you're familiar with. It's called Orders/Goals. So you're all familiar with this, those of you who have generated 485s off of your visit notes are. A couple of new buttons related to conditions of participation. So if you will go to box 21, Orders, what you're going to see is a few new buttons. And here are a couple of the new buttons that are in here for conditions of participation. Are the homebound items. I'm going to go ahead and pull that in here. That is your homebound status. It pulls your criteria 1 and 2A and 2B into your 485. And the other one is to pull your emergency plan, which is that new screen I showed you at the beginning of the presentation. So one more screen I'd like to show you in point of care that is required for the new conditions of participation is care plans. I'm going to go ahead and add a new care plan by clicking on the Assess button. So what you'll notice is you have several tabs up at the top. You would put in a date. The date could be any time from January 13th forward. Up at the top you have the progress and target. So the progress, this is going to be the patient's progress toward goals. And you can see that you can mark their progress as how far along they've gone. Obviously, if you're just starting with your care plan, they may only be at 0%. And if they're further along, you can indicate that in here. Then you want to indicate the target. So, if the patient is not ever going to achieve 100%, that's fine. Maybe that patient, you're only anticipating that you're going to get them to 60 or 80%. So that's why you have a target, so you can see what your goal is in terms of reaching the target for that particular patient. Okay, so the progress and target are what satisfy the measurability requirement for conditions of participation, because they do specify that you have to indicate what percentage the patient is at as you assess the patient going along within your care, and that measurement does need to be a numeric. So that's why we have progress and target, and those are very important items to assess on your care plan. Within the care plan itself, you've got a care plan tab that allows you to indicate the plan, the short-term goals, and the long-term goals. So that's just a very simple planning tool that you can use here. You can also click on View History once you've added items in here so that you can view the history for these items. The next tab over is Patient Communication. For these, the top one is Instructions for the patient. The conditions of participation require that you write your instructions so they can be understood by your patient. So if you choose to provide the patient with communication that is different from what your regular care plan specifies, this would be where you could do that. Some agencies are opting instead to just write their 485 plan of care in such a way that the patient could understand it, and that's another option for you as well. Care preferences are any preferences in how the patient prefers to be visited or prefers their care. Their satisfaction you can record, and their strengths you can record. These last three items are specified by name on the conditions of participation, and so you should go ahead and complete those items as well. The next tab you have is Planning. What this is going to allow you to do is actually see more information about the patient in terms of what is in the system already. Alright, so this is going to allow you on this first tab where you have orders under planning to see the orders that are on the plan of care for the patient. That has all the orders in here. And if you scroll down, you can see the details of their orders in there. The next area will show any discipline orders, and what that means by discipline orders is an order that you've entered into the system as a supplemental order that has the order type of discipline orders. And what you would use that for is when the frequency changes and that sort of thing. So any frequency changes should show up right here under discipline orders. Any PRN orders will show up here, and if the patient has had any PRN visits, those will actually be listed here as PRN visits. So you can match up PRN orders to PRN visits here. So this screen is intended to give you just a quick look at what is in the system already in terms of orders. The next tab over is Goals. This is going to pull the goals from your plan of care. The next tab is Outcomes. If the patient has existing OASIS records, those will pull in here as well. Next, if the patient has any events, and these events include falls, infections, and transfers, those events will be listed here so that you can see any events that have been recorded. And again, falls are recorded under fall history. Infections are reported under the infections area. And transfers are recorded by your OASIS transfers. What you'll find for your care plans is this button is going to be in the required area on every visit you make henceforth. So you may want to go back to any visits that you've made starting on January 13th and make sure that you add in care plan documentation so that you can view that going forward. Just so you know, there are 2 versions in Barnestorm of the care plan screen. This is the simplified version of the care plans. We also have a much more detailed version that will allow you to break down your care plan for each individual goal and intervention. If you're interested in getting a demo of the more detailed care plans, please give us a call or a chat and we'll be happy to speak with you. To summarize the conditions of participation clinical requirements, make sure that you document the visit at the place and time of the visit, so at the patient's home. Be sure that you document all items that are read in Barnestorm Point of Care. And please complete all of the following screens which are required: review meds, aid supervision, facility history, infections, fall history, ADLs, pain, cognitive, psychosocial, homebound, and care plan. Thank you for